Hello, my name is Kalisha, and I'm currently going to school to be a medical lab technician. When I first started off with my current program, I would get asked a lot of questions about what it is that I'm going to school for and what an MLT or medical lab technician, for short, from what I'm going to call it from now on, does. And I've created this presentation to help inform about this profession. So what is a medical lab tech? An MLT, first off, they usually work in a hospital or clinic setting, and they usually work in a lab part of that. And then what are the responsibilities? Their responsibilities include collecting samples to be tested, such as blood or urine, and then performing the ordered tests that have been ordered by physicians on those samples and communicating the results with the patient's provider. Other responsibilities include performing quality assurance testing to ensure test results are accurate and performing maintenance on the machines to make sure that they are performing testing correctly. So how does one person become an MLT? First, they need to join an accredited program that is specific for MLT or medical lab technician, and these are 2-year degrees. In this program, you will learn how to properly collect specimens and test them, and then after graduation, you will take an MLT certification exam, and once you pass, then you can be registered as an MLT and work in a hospital or clinic. There are a couple of different departments that an MLT can work in the lab, and now we're going to go over what those departments are and what they do. So the first department we're going to start off with is hematology. Hematology is the study of blood, and this includes your red blood cells, your white blood cells, and your platelets. And then this picture that we have here, this is a picture of all the cells that are in your blood. A would be a red blood cell, and then B, C, D, E, F, and G. Those are all different kinds of white blood cells. And then as an MLT, you will learn how to identify those different white blood cells. And then H would be a platelet. Different testing that can be done here by an MLT, that would include a complete blood count or a CBC, and then a white blood cell differential. This can be done either manually with a microscope, and then the MLT will be the one that is counting up the different types of white blood cells that there are and identifying them. And then you can also test effectiveness of your platelets and your clotting factors, which would be your coagulation part of the hematology department. And then next we have the microbiology department. This department works with the study of microorganisms, and those microorganisms include bacteria, parasites, yeast, fungus, and viruses. In this department, you will be testing different swabs and different samples for the presence of either bacteria, parasites, yeast, or fungus. And what we have pictured here actually is a blood agar plate, which is used to grow bacteria, and there actually is bacteria growing on it. There are different types of blood agar plates that grow different types of bacteria, and then there's types of blood agar plates that will grow all types of bacteria. And it's just knowing which bacteria is growing on that and identifying that through that way. And then there's different tests that you can do on the bacteria itself and results that you get that can help determine the type of bacteria that this person has an infection from. With parasites, yeast, and fungus, these will be identified under the microscope. They all have different special characteristics that they have on the microscope and different looks, so they can be identified visually. The next is urinalysis. Urinalysis is the examination of urine, but also the examination of other body fluids, including synovial fluid and cerebrospinal fluid and even seminal fluid. You're going to look at these microscopically, macroscopically, and chemically. First, we're going to start off with the microscopic. So the first testing that would be done is your microscopic examination, which is just looking at it as it's in the container and determining the type of color it is. Usually urine is a yellow color, but not everybody has healthy yellow urine, so urine can be red or brown or even green sometimes. So it's documenting that and then documenting the clarity of it. It can either be clear or just a little cloudy, like you can kind of see through it, or turbid, which means you just can't see through it at all. And then the other testing that can be done, which is chemical testing and microscopic testing. The chemical testing, you're looking for different chemical properties in the urine that may be normal or abnormal. And this would be, sometimes may have ketones in your urine or glucose, and you could have white blood cells or red blood cells in your urine, and we would test to see if that is present or not. We can also see if there may be the presence of bacteria as well. If bacteria can transform your nitrites to nitrates, that can be positive. So a lot of times we're testing for urinary tract infections in the urinalysis department. We can be testing for just your basic kidney function and making sure that your kidneys are functioning properly. We can also do drug testing, which a lot of people think of when they think of urinalysis, I'm sure, with getting a job and having to go be drug tested for it. The next about is the chemistry department. This department deals with the chemical examination of the blood and other body fluids. So it can look at your electrolytes, your metabolic byproducts or products, and then your proteins and lipids. This what we have pictured here. This is actually an Accu-Chek, so this would be testing your glucose. So your glucose is also part of your chemistry department, as long as checking your sodium levels and your potassium levels. Other testing that can be done that's pretty common is a lipid panel, which is testing, trying to determine the different types of fat that are in levels in your blood, such as your LDLs and your HDLs and your cholesterol and your triglycerides. We can determine liver function through liver function panel tests in the chemistry department, and then we can also determine if someone's having a heart attack with different cardiac markers that are there during heart attacks. Next department that you can work on is the immunology department, and this department is the study of immune function. And with your immune system, when it's under attack, from bacteria or viruses or something like that, it will create antibodies, and so we're testing for the presence of those antibodies. A lot of it is kit testing that is done here, and I'm sure a lot of you have heard about mono or mononucleosis infections or the Epstein-Barr virus, or I've had mono yourself. So if you had mono and got tested for it, it would have been in the immunology department that it got tested. We can also test for if someone has rheumatoid arthritis, and that's actually what's pictured here is a kit test for testing for rheumatoid arthritis. And we're going to talk about is the blood bank, also known as immunohematology. So this would be determining your blood type, and blood types include A, B, O, AB, and then your Rh typing, which is if you are positive or negative. Your red blood cells have certain antigens that are on them, and so that's what we're testing for in this department. Is we're testing for those antigens that are on your red blood cells, and seeing if your certain blood type you are, and if that type matches anything. So if you need a blood transfusion, then we can make sure that we are giving you the correct blood, because if we give you the wrong blood and somebody gives you the wrong blood, it can result in death. MLT or what they do, please feel free to leave them in the comment section below. Thank you.